I'm Linda DeMello. My specialty is breast imaging, and I started practicing in 2019. I went to medical school at New York Medical College, did my internship at Yale, and then I did residency at Brown University, and I also did my fellowship at Brown University. When I started medical school, I just loved everything. I loved seeing patients, I loved anatomy. I loved doing procedures, so I was trying to figure out a specialty at that time that would include all of those things that I really loved. And radiology pretty much sums that up. There's a lot of anatomy, there's a lot of pathology, we do procedures, and I have no regrets. I love doing what I do every day. Fighting breast cancer is something that brings me a lot of fulfillment in my career, and keeps me going every day through the hard days. And I really enjoy just seeing patients. We see them back 6 months later, so there's a lot of continuity of care, and that's something that I love about what I do. So I always try to imagine that I'm either in the patient's shoes, or if it was my mother or my grandmother, how I would want them to be treated if they were in a breast health center, or if you're giving them bad news. So I really try to think about patients first. That's my philosophy. My husband and I, we love biking, we love to hike. We like to try to be as active as possible. Obviously, our careers are very time consuming, so we try to do things outside in nature and spend as much time together as possible.